Hey everyone, what's going on? Today I'm going to be sharing a video that I actually recorded a couple months ago that I never posted, but I think it will hopefully bring you a lot of value and insight to something that a lot of y'all might be thinking about or facing right now, and that is whether to pick OT versus PT. So that's what we're going to talk about today. I'll see you tomorrow. Enjoy! Hello everyone, welcome back to another video. If you're new here, my name is Arwen and I'm an occupational therapist sharing my life with you. Today we're going to talk about a highly recommended topic, something that I think many of you will benefit from when you are considering your career choice as an OT. From what I've seen in the comments, a lot of people that watch my videos are on the edge of considering OT over another career or considering PT versus OT. So today I thought we would talk about PT versus OT. In this corner, coming in at 105 pounds, 4'10", it's the OT. And in this corner, there is no PT to defend themselves today. But in all honesty, I'm going to try and be as clear and insightful as possible, but I'm only human, so please don't get mad if I forget anything or leave anything out. So I've decided to compare PT and OT in 3 different categories. First one is training and education. So cost of going to OT or PT school, what you'll learn, how long it takes. The second category is going to be work settings and client populations that you may work with. And lastly, salary. Okay, category 1, education and degree. So as of right now, both OT and PT require doctorate level degrees. OT is a recent change, and there are still probably programs that haven't fully switched over to changing their program to a doctorate level. But if you are applying to OT school now for next year or the year after, it will be a doctorate level program. It is a little bit controversial as to that recent change, but that's the way it is now. Both require an undergraduate degree before entering school, and depending on how long it takes you to get that undergraduate degree, it will take you around 7 years after high school to become a PT or OT. So with regards to tuition cost, I would say, based on my experience and then kind of what I've seen on the internet, it'll be around $25,000 to $40,000 just for school-based cost alone. Paying for all your classes, your books, supplies, travel, tuition alone will probably be around $25,000 to $40,000 depending on where you go to school. Every school is going to be a little bit different. You might have out-of-state tuition, that sort of stuff. There are other variables to consider, which includes housing, food, and basic, cost of living while you're actually going to school and studying. That's going to be a whole nother cost on top of the actual tuition. So just consider that you might not be able to work at all while you're going to PT or OT school, depending on how awesome you are. If you do, kudos to you. So you will have to consider housing and cost of living and all that into your finances and all that. I ended up taking out additional student loan money to pay for my cost of living, which is why I had over $50,000 in student loan debt. So try not to do that. With regards to what you're going to be studying in school, a lot of the prerequisites for OT and PT are going to be very similar. You're going to be studying human anatomy, physiology, kinesiology, musculoskeletal science, neuroscience. While you're actually in school, a lot of the classes will also be similar. You're going to study orthopedics, you're going to study human health and development, you're going to have classes on professional development, learning medical terminology, how to write documentation and do evaluations, learning how to use an electronic health record, learning how to write effectively and proficiently, because you really are learning a whole new language. So you're probably thinking, what's the difference between PT and OT? They're so similar. And you would be correct. But I think the really big difference is the intervention approaches, the underlying ideologies, theories, frames of reference that are used to do treatment and evaluation and work with individual clients, and that really guide overall practice. OTs learn about how to analyze an activity and how maybe the environment could be modified, or how the task could be changed, or how the client needs to improve in terms of their function or skill in order to meet their goal or accomplish what they want to. OT classes are going to tend to focus more on cognition, mental health, upper extremity rehabilitation, so learning how to treat the shoulder and hand and wrist, which is all very complex. Whereas PTs may tend to focus more on therapeutic exercise, manual therapy, exercise theory, sports medicine. They can do vestibular rehab, and then again, they're gonna focus more on the lower extremity rehabilitation or injury to the legs, so ankle, knee, hip. But again, that's not to say that OTs couldn't do that either, or that PTs couldn't treat a shoulder injury. There were many times where I worked with patients who had had a hip replacement and teaching them safe mobility, dressing, and bathroom strategies. So it really just depends. Both PT and OT have clinical rotations embedded into their programs. Depending on how the program is set up will depend on when you do those clinical rotations. In OT school, we call it field work, but you do have to pass those clinical rotations in order to graduate. And that just means that you're not gonna be in school, you're actually gonna be in a work setting like a hospital, a rehab center, school setting, and you are gonna be under the supervision of an actual PT or OT, and they're going to be teaching you and guiding you and helping you actually become a therapist, and they're gonna be the ones to give you a pass or fail and basically say whether or not you should be a therapist. And lastly, you probably already know this if you're watching this video, but PT and OT schools are very competitive. On the UT Health Science Center in San Antonio, it says that 520 applicants applied and they accepted 42 into their class. So again, highly competitive. Okay, category number 2. Work setting and patient populations. I feel like I'm on a game show. So as you can guess the theme, the work setting and patient populations are going to be very similar for both PT and OT. The most common work settings are going to be acute care, skilled nursing facilities, rehab, both inpatient and outpatient, NICU, ICU, LTAC, long-term acute care, home health, pediatrics, school setting, and there are, niche settings like early intervention or sports medicine for PT, but in general, I think those are the main work setting categories. Both PT and OT can treat the lifespan, so we can treat babies in the NICU, and we can treat the 101-year-old that is still going. And we're gonna treat similar conditions, illnesses, and injuries. But again, the big differences are gonna be the roles and responsibilities in each of those settings and how they go about applying intervention to each individual. And that's just something that you'll have to learn for every job, because every job is gonna have different requirements and expectations for what PTs and OTs might do. So in one setting, the PTs might do hip replacement rehab, and in another setting, OTs might be responsible for that. So it really just depends. Or they could divide it half and half, it just depends. Okay, so we're gonna talk about roles within each setting. And in general, PTs and OTs follow a similar set of guidelines within their daily routines. Both are gonna do individual treatments with clients. Both are gonna conduct evaluations, use assessments, write progress notes, write discharge notes, write the evaluations. But again, each treatment and interaction is gonna look a little bit different. So if you wanted to be really extreme, you could cut a line across the body and say that OTs are gonna treat the top and PTs are gonna treat the bottom. And I think that's a really basic and generic understanding of what PTs and OTs do, but it is the easiest way to probably talk about the differences. We know that the body doesn't work like that. You can't work on lower extremity and just ignore the brain and everything else that's going on. So take that for what you will. I think the uniqueness of OT is that we're trying to treat the whole individual, not just a component of them. So not just helping them regain function of their hand, but trying to make that meaningful in some way. OTs recognize the importance of culture, spirituality, personal beliefs, personal experiences that have led that person to get to that point in their life. And we use that to try and create meaningful interventions and strategies for each person to accomplish their goals. The OTs deal a lot with what we call activities of daily living, or ADLs for short. Brushing your teeth, feeding yourself, using the bathroom, all those things that you take for granted in your day-to-day life all of a sudden become some of the biggest obstacles in the world. As OTs, we're trying to incorporate meaningful activities and tasks within the intervention. Wiping a counter, putting on makeup, brushing your teeth, playing cards, folding laundry, putting up things, typing on a keyboard. A lot of times OTs will try and disguise like strengthening, balance, coordination into an actual functional task through the actual activities that the person's going to be doing every single day. As OTs, we can also treat feeding and oral motor disorders. Now, not everyone does, but it is an option. So we can work with children who have picky eating. We work with children that have autism. We work on self-feeding. So, learning how to scoop or, feed yourself, strengthening oral muscles. The other area is working on fine motor or small muscle movement. So precision things that might be a little bit more difficult if you've had a stroke or you have a neurological disorder. All those things suddenly become much more difficult. OTs also focus on cognition and environmental components. So when I was in school, I had a professor that always told this joke. He would say, oh yeah, the patient, they can walk 200 feet, they can walk to the kitchen. And then when they get to the kitchen, they blow themselves up because they couldn't remember how to turn on the oven. So one of the important things to consider, and I think PTs are much more aware of this, and this was, just a joke that he told, but there is more to therapy than just regaining muscle strength or muscle movement, flexibility. You may have all that, but you may have regained all that, but then your brain still isn't functioning well enough to remember things, to remember to turn the oven off. So that's kind of a component of OT, is teaching some cognitive strategies or techniques to help that client fully function motor-wise and cognitively. But don't get me wrong, we still use exercise. We're still going to use weights and equipment and TheraBands. The end goal is not being able to lift the weight. The end goal is going to be able to feed yourself. So what do the PTs do? I'm not a PT, so please forgive me and don't hate on me, PTs, if you're watching this. I'm not trying to throw anyone under the bus. I'm trying to give an honest comparison of both professions. But I think PTs do have more of a focus on a client's ability to perform specific movements and perform them really well in the most functional way. And this is only my opinion, but I do think that PTs have a better understanding of kinesiology, exercise, and biomechanical principles that they implement during their treatment with clients. I feel like they are going to tend to focus on balance and mobility and walking in their home in different environments and making sure that they're safe. I feel like a lot of their efforts are going to be centered on the functional mobility, gait performance, muscle strength, endurance. They're going to tend to focus on larger muscle groups. So they might do a lot of core strengthening, lower extremity strengthening. They might be more inclined to recommend the use of equipment like a walker or a wheelchair cane. And I think they tend to use more manual therapy, manipulation, joint mobilization, traction, and then exercise-based techniques and strategies. Both OT and PT can recommend the use of equipment. Both are going to teach the client how to use that and provide information and patient education on all those things. Both are going to use modalities, so that would be anything from like electrical stim, heat, ice, kinesiotape, anything that's going to be used to promote improved function. But again, the end goal might be different for OT versus PT. Okay, moving along here, people. Are y'all having fun yet? I turned my air conditioner off so that it wouldn't be noisy for you, and now I'm sweating. So I really hope you enjoy this video. Both OT and PT are going to be trained in how to use particular types of assessments, how to conduct evaluations, how to write progress notes, how to know when to discharge a patient, how to know when to recommend equipment. PTs and OTs, I feel like, work really closely together, and Another thing to consider is there's usually an entire medical or rehab team that's working together. It's never just going to be a PT by themselves or an OT just going solo, treating the patient completely on their own. That's not really how it works. You're always going to be working with nurses, with their doctors, with specialists, working with PT assistants or OT assistants. There's always going to be a huge team that is supporting the client in general. So I think it's important to know your role and know how to work as a team, whether you're a PT or an OT. One of the things that I recently heard at a training that I went to was that the speaker said, is that if you have some sort of injury and you go to a surgeon, they're gonna wanna fix it surgically. And if you go to a neuropathic doctor, they're gonna wanna treat you naturally and holistically. And if you go to a PT, they might wanna try and do some conservative treatment, like strength training and alignment and joint manipulation. So the point of that is that while PT and OT are really similar, they do tend to approach client disorders and deficits in a different way, and that doesn't make either one better or worse. Both PT and OT are going to want to have the client to reach their fullest potential and be able to get to the best level of function as possible. We're just going to probably approach it in different ways. And as I think you can tell from this video, PT and OT are very similar on the surface, and I think below the surface the lines are starting to blur more, and that does make it difficult when doctors are trying to recommend the best type of therapy. They don't always know, and I think they're more familiar with PT as a profession. As OTs, I think we have to promote ourselves more and promote our profession and what we can do and our skill set and our knowledge, and how we are a benefit to the medical team. And occupational therapy was actually established as a profession before physical therapy in the year 1917. Just FYI. Look, I'm gonna be biased, okay? I'm an OT. Obviously, I'm gonna be biased, okay? And now on to the last category. That was my drum roll. So salary. So I would say, based on experience and just general knowledge, that starting salary for starting entry-level salary for PT and OT is between $60,000 and $80,000. I do think PTs tend to skew a little bit on the higher range over OTs, and both I think have the potential to earn up to $100,000, but you might hate your life because it's going to be a really crappy job, and that's why they have to pay you $100,000. In general, I think the salary is pretty close, just PT skewing a little bit higher. Salary is going to be so dependent on your work setting, whether you work in a rural or city setting, whether you've been working for 1 year, 5 years. There's so many different factors that can play into salary, there's so many different factors that can play into salary. But just know on average, I would say between $60,000 and $80,000 for both. The last big difference that I want to point out about PTs is that in some states they have direct access to patients. And what that means is they don't need to wait for a doctor's referral. If they own their own clinic, a person can walk in and say, hey, I'm having some back pain, I'm having some knee pain. Can you help me? And the PT can make their own recommendations, provide their own treatment and interventions, and they can do that all without the influence of a doctor. And again, that's dependent on which state you're in. I don't think that is allowed in Texas as of right now. And I think as an OT, that would be really awesome, and maybe we're headed that direction now that we are at a doctorate level degree. I'm not really sure, but that would be pretty cool. Let's reflect, let's come together. We've gone on this journey about learning about PT and OT together. We know that degrees are very similar, now both requiring a doctorate level degree. Underlying foundation of knowledge and training is going to be very similar. The theories, frames of reference, and intervention strategies and approaches are going to be what set OT and PT apart. With regards to salary, PTs are going to tend to skew a little bit higher, But it, you know, in the end, it all really depends. It depends on your setting. If you want to specialize, and OTs and PTs, you know, can kind of specialize, but they can also be really general, and they can both work through the lifespan. So I think what it really comes down to is, in my mind, PTs are more logical and straightforward, and OTs are kind of more artistic and quirky. So OTs would be like Captain Kirk, and you know, they're kind of quirky, and they're always doing something different, and you never know. And then, you know, PTs are gonna be like Spock, and they're very calm and logical, and they like to think things through before acting, and they might be more straightforward, but not as much fun. No, I'm just kidding. If you don't know who Captain Kirk and Spock are, then I don't know if we could be friends. Okay, I think we have come full circle, and hopefully you now have a better understanding of occupational therapy and physical therapy. I threw a lot at you. Leave me some comments if you have more general questions. I always try and answer all of your questions, and I will see y'all in the next video. Thanks for watching.